It doesn't mean your partner doesn't love you, and it doesn't mean that they're cheating on you or don't want to be in a relationship with you. Your partner not wanting to have sex with you, it doesn't necessarily mean that all is lost and it's all doom and gloom. There are many reasons why your partner may not want to have sex with you. I'm going to go through those reasons. I'm also going to tell you what you can and need to do about it. If this is bothersome to you, guys, I'm Dr. Jen. It is good to see you. I'm a practicing family physician. I'm coming from the perspective of a number of videos I've done on what happens to your vagina if you don't have sex for a long time, what happens to your penis if you don't have sex for a long time. I'll post and link those videos along with this one. But many of you have written on comments on my videos saying, hey, my husband and I haven't had sex in a very long time. My girlfriend and I have stopped having sex as much. So many of you have written this. So I want you right now, if you have ever gone through a period of less sex or changed sex in your relationship, please write it in the comments. Not only are you going to help encourage other people, but also let us know what happened. What did you do about it? Tell us what you did, because it might just help someone else. First thing I need to tell you is don't be shamed and don't be embarrassed. Now, let's go through some of the reasons why your partner may not want to have sex with you. Let's start with some of the health issues. Many of these come from being a family doctor for over 16 years. I've had patients tell me this, patients experience this. The first thing is issues with your sex organs. What am I talking about? If you have an issue with your vagina or your penis, that in and of itself could make it difficult for you to want to be sexually active with your partner. Let me give you some examples. Erectile dysfunction. Okay? Or the fear of having erectile dysfunction. On the flip side, vaginal dryness. Ladies, vaginal dryness can be a big deterrent to having sex because it can be painful. Erectile dysfunction, on the other hand, it's not necessarily a pain thing, but it might feel shameful, or there might be stress or anxiety associated with having sex. If you have a rectal issue, if you're dealing with hemorrhoids, if you're dealing with something down there, and I say down there quite literally because in our private areas, it can not only be sensitive, literally, but sensitive mentally for us to be intimate with someone else. So health issues such as those absolutely can make a difference. Let's talk also about stress. Anxiety and depression, oh my gosh, they are notorious for killing libido and promoting, in some cases, erectile dysfunction. Many people struggle with their sexual intimacy and libido when they are anxious or depressed or struggling mentally. Stress can do the same thing. If you're worried about the bills you have to pay, if you're worried about your job, if someone recently died, etc., all of that affects our desire to have sex and perhaps even our ability to have sex. And notice everything I'm talking about doesn't have anything to do with you. You might be watching this video because you may be feeling bad that your partner doesn't want to have sex with you. What did I do? What have I not done? Am I not enough? That's a very natural feeling. But notice everything I'm talking about really has to do with them. Arthritis. I've seen this over and over and over again. If you're struggling with knee arthritis, hip arthritis, back issues, having sex actually could be sometimes impossible or uncomfortable. You may not be able to perform the way you want to. Positions might need to be adjusted, and all of that can bring about shame, feeling embarrassed, and maybe just avoiding sexual activity altogether. Also, your weight, your body size, your body habitus, or let's broaden that out furthermore, how you feel about yourself. I say weight just because I've had patients tell me their weight in particular has maybe discouraged them from wanting to be intimate. It doesn't have to be your weight, though. It could be anything about yourself that you just may be uncomfortable with. You may be just insecure about. Those things will likely get in the way of sex. Also, though, there are medications that can lower libido. Antidepressant medications, interestingly enough, can lower libido. There's tons of them, actually, by the way. So if your partner has started on a new medication, what if it's just a new medication they've started that's just changed the way that they feel? Also, other diagnoses can literally change someone's ability or desire to have sex. Okay, low testosterone, other endocrinology diseases, other conditions that have nothing to do with endocrinology. Okay, maybe you're just going through a lot of health stuff, and that falls into the category of stress. But you see what I'm saying? None of this is you. This is stuff maybe having to do with just your partner. Now, let's move on to stuff that may feel a little bit more personal. okay? Because yes, health conditions can get in the way, but there's also emotional conditions that deal with the relationship, okay? It is possible that your partner may simply feel like they want different things sexually than you. Okay, are you aligned sexually? Are you compatible from an intimacy standpoint? Do you share the same values in that regard? If your partner has different values or feelings about intimacy or how they want to be intimate, well, maybe that could be a barrier for them having sex with you. The other thing, though, is we have to call a spade and look at the elephant in the room. Has your relationship changed? Look, if your relationship has changed, does your partner feel differently about you or about the relationship? Do they no longer feel sexually inclined towards you? Have they changed in terms of how they're feeling about the relationship or the relationship you currently have? As hard as that pill is to swallow, it's a very important pill that we sometimes do have to take a look at. Do they feel differently? Has something changed? Sometimes, life just gets in the way. I mean, it could be before you were married or together, you were having sex 5 times a day. But now you got kids and you got dogs and you got all the mortgages and all this stuff. And maybe just the priorities are different. And so maybe sex falls down here as opposed to being up here. And it's just that other life stuff has, kind of crowded the picture. Now, there are plenty of other reasons why your partner may not be interested in having sex with you. Okay, those are just a few, probably some of my top ones as a family doctor. But now let's talk about what to do about it. Okay. Now, as I said in the beginning of this video, and I mean it, this doesn't mean that everything is doomed. It doesn't mean your partner is cheating on you. It doesn't mean they don't love you. It doesn't mean that you're going to split up, break up. I want to give you hope because this really is just the truth. The first thing that needs to happen, in my opinion, is you've got to talk. You got to talk to each other. Because until you have a chance to talk to your partner, really, all you can do is speculate and guess at what the issue could be. Now, of course, your partner may not choose to be honest with you, but that's on them. That's not on you. It's important to express yourself. And sometimes I feel like, when I have something that's on my mind, something I do in my personal life, whether it's with a partner or a family member, sometimes to try to keep the dialogue open and to make sure that my partner doesn't feel threatened or as though I'm sort of berating them or beating them up or being critical. Sometimes they'll say, I've started to feel as if, or I'm concerned that blah, 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 sort of putting it in my perspective. I'm concerned that you feel differently, or I'm worried that you might have changed, or I'd like to understand more about how you're feeling. As opposed to the approach of, you're not having sex with me, and why don't you want me anymore? Something that can be combative. That is just one technique. And also, let me say, I'm not a therapist. I'm not. I see a therapist, okay? I believe everybody should see a therapist, but I'm not a therapist, okay? I'm not a sex therapist. I'm a family doctor who sees a lot of patients and who has over the years and has had these conversations lots of times. But speaking of therapists, besides, and I would say the first thing is talking. The second thing I would do, in no particular order, but sometimes talking is really tough for us. Sometimes we actually need help to talk. And that's where often a therapist can really come in. Therapists and sex therapists not only can help us communicate effectively and more effectively with our partner in therapy and outside of therapy, but sometimes, no, all the time, helps us better understand how we're feeling and then giving us tools to help navigate that with our partner. I can't recommend a therapist and a sex therapist enough. Now, of course, both parties have to be willing to go through this and to undergo it, but there is no shame in that. And in fact, you're utilizing amazing resources. So if you can't talk to each other, just the two of you, and solve it and work it out, you absolutely need to be seeing a therapist. And I would suggest a sex therapist. If I haven't said it already, I'm going to say it again. Don't blame yourself. No. Don't blame yourself. Now, there are other ways to sort of navigate this. I should also say that, not everybody needs sex the same way. If your relationship evolves to a place where you all don't have sex or you have minimal intimacy and it works for both of you, then that's fine. This is not saying you have to have sex to be in a relationship or you have to be intimate. Your relationship should be whatever you two or three or however many are in the relationship. It depends on what you all decide. I'm only talking from the vantage point of your partner's not having sex with you and you're not okay with it. But sometimes relationships can be redefined and it's okay with all partners and all parties. If you do want more intimacy, consider other things, finding other ways to connect while you're working through the sex piece. finding ways to prioritize connection. It could be trying different things. It could be looking at sexy videos together, or doing things that you used to like to do, or sort of bringing back the romance. Look, I know a lot of this sounds cliche, but it might just give you some ideas. The bottom line is, if you don't take anything else from this video, take that your partner not wanting to have sex with you may not have anything to do with you, first of all. And I mean that in a good way. But the second thing is that the best thing that you can do for you and your partner is to talk openly and honestly and create a safe environment for you both to do that. Because at the end of the day, what matters is what's right for the two of you. Don't ever feel embarrassed because you want sex, because you want physical intimacy and sexual intimacy. No one should ever be able to say, well, why is sex so important to you? Are you kidding me? Sex is very important to relationships. So don't you ever feel bad for that. You have every right to want what you want in your relationship. And that's all right. In fact, it's quite normal. So I'll stop there. Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel. Follow me on Facebook, Instagram, LinkedIn, WhatsApp, YouTube, everywhere, Threads. Sign up for my free health newsletter at drjencaudle.com. Let me know what you think in the comments. All right, good luck.